Welcome back to the Realistic Health Report. I'm Allie, this is Matt, and this is where we talk about realistic health news that's going on that the mainstream media doesn't cover or doesn't tell the truth about. Today we have a pretty important subject to talk about. The Mayo Clinic came out with a public statement after being exposed on ABC News that three of their hospitals in Minnesota will be discontinuing respiratory therapy services during night shifts in their hospital, which means for 12 hours a night, allegedly, that's what I'm assuming when they say night shifts, from 7 p.m. to 7 a.m., they will not have a respiratory therapist on site. They will be on a video, on a screen, like a telehealth.
Yeah, I think I saw in the reports that it was from 11 p.m. to 7 a.m. So it's not quite 12 hours, but if you had a loved one who was intubated at, and it was midnight and you found out that they expired overnight and you're like, what happened? And they're like, oh, they just had really bad breathing issues, and the telemed respiratory therapist just couldn't figure it out. He kept saying, push the right button on the ventilator, and everybody kept pushing the right button, but what he meant was the left button because everything was backwards, on the camera. It's so fucking stupid.
It's so stupid. It's so unsafe. It's just like right in front of our faces how much they don't care about patients.
They don't give a fuck.
They don't
about
care
the
if you
patients.
die. They don't care
No.
if you die.
No.
They don't care if you live or if you die.
No.
And
like,
it's so obvious.
Clearly. Like the respiratory therapist organization, whatever the acronyms are for that, they're freaking out about it because they're like, this is stupid.
Oh, I think they're striking.
Yeah.
Currently.
I don't know. I don't know if they are or aren't, but it's like, yeah, everybody but Mayo Clinic, who's nonprofit, but they made over $19 billion last year,
and 1.29 in their own income.
Right. And it's like, oh, why are you cutting this? Like, what possible reason could they have that this is better patient care? Like Mayo Clinic talking to you, what is the benefit? You need to save money for what?
Where my mind goes is I don't think they're saving money. What I think is happening, and this is my tinfoil hat, this is only my opinion, not from anyone else, but I think that it's very common for hospitals, not just Mayo Clinic, that they're just pocketing all the funds and going bankrupt. They're buying these corporations out, they're going bankrupt, and then doing these things. There's so many reports of maternal child L&D units, PICUs, pediatric units being closed around the country, and clinics and hospitals shutting down with no, communication with the community, and that's scary. But it's such a real thought to have and a real question to have. Are they just sucking the money out somehow? And is this like a fraud situation?
I don't know. I mean, there's no way to know. It's not like they're going to come out and tell us what their nefarious plans are, but it's very Dr. Evil-y. It's like,
well, when you start looking up other things, in 2023, the Mayo Clinic lobbied millions of dollars against Minnesota passing a safe staffing law.
Yeah, they don't want that.
And now they're saying the reason that they're cutting back on respiratory therapists is because there's a workforce shortage. That's not true.
You don't get rid of a whole shift at night because there's a workforce shortage. What you do is you raise the pay and give people incentives to come to work. It's not something you go, you know what? Nah, we don't really need that.
Yeah.
I mean, I worked in a freestanding emergency department known as a FED, and we did not have respiratory. They didn't want to pay for a respiratory therapist. So this was basically a really high-end urgent care. We could run a code in there. We had the geyser squeezer. We had CT. We had central lines. We had ER docs. We had everything you need for, we had ventilators. We had everything you need to run anything that came in the door. And they trained us RNs to use the ventilator. But it's like, it was not our gig. Like, it's not what, when I say trained, like, I think it was like a 4-hour class on just how to run the vent. Like, like, we know, like, PIP and, and
Do you
PEEP and all
think
this kind of
these
stuff. But
standalone emergency rooms started the trend of no respiratory therapist needed and an RN can use their license
I don't
and a
know.
doctor?
I don't know.
Do you think these hospitals thought, oh, they can handle it?
They started pushing the thing where you didn't need a respiratory therapist to give nabs and stuff, years ago. I remember, like, before you'd be like, oh, doctor ordered, a bedside nab, and they'd be like, well, you got to get respiratory to do it. And I'm like, I can put it in there. I know. I can turn the O2 on. I know how to do it. Like, nope, has to be done respiratory. They're trained and licensed, and you're not. I'm like, all right, cool. I don't give a shit. One less thing for me to do. But I would never have thought, I can run that vent. Like, I'll do the ABGs. I remember they trained us for ABGs, which is super fun. It's like, I don't want to do that. I don't need to do that. I got other shit to do. It's just more shit for me to do. Yeah, right. Like, I got to be a cop. I got to kick the shit out of people on a hold to keep them there, or I'm in trouble. And now, if something goes wrong with a ventilator, or their ET tube comes dislodged, or who the fuck knows, some problem with respiratory in an emergency, I'm the guy now? And how's that going to go down in court? Like, so what was your training for operating this ventilator? 4 hours on a Saturday, and then yearly 1 hour refresher course. So you don't have a license in respiratory therapy or any kind of extensive training? No, I sure don't. And how long was your ABG training? Hour and a half. Did you practice on anybody? Well, people with a respiratory therapist there, we got to practice. We had to do 2 successful ABGs with a respiratory therapist supervising us. And then ask me how many fucking ABGs I did at the FED. 0. So like a year or 2 goes by and you don't do any, and you're like, shit, man. And, not even a year or 2. Let's say you got trained to do an ABG, and then like 3 months goes by. You don't do it. Or a month. You're going to be confident with that? You know you can do it? Just, whip it out. I'm Johnny Badass
The
over
scary
here.
thing is there are people out there.
No, I know. There are lots of nurses out there like, I could do it. But, you could. I could do anything. I can stick a needle in somebody's artery and watch it fill up the plunger. I could do that. I understand sterile technique. I can physically do it. But is it my specialty? No.
Do you have the credentials for that, sir?
I do not. I mean, I got credentialed for it.
What are your credentials to be talking about this?
Yeah. So guess who's going to get their ass sued when something goes horribly wrong? The nurse. And do you think Mayo Clinic gives a shit about the nurses?
Absolutely not.
No.
And they've proved it publicly multiple times. Yeah. I don't know. This is just a concerning moment because this is a huge hospital health system that is known to the public to be very renowned and very good for research. And, people talk really well about the Mayo Clinic. But seeing this and hearing from healthcare workers that work there currently and hearing what they say is going on is very concerning for the public and very concerning for the way our healthcare system's going, because I think we're about a little behind on fixing this healthcare system. It's mostly just making people aware of what's going on.
Yeah, it's very concerning. Like, I just don't understand what the hospital, like, this had to pass through the C-suite. Mm-hmm. All the corporate executives were all up there going, all right, how can we get another $1 million a year? Respiratory therapists. Fuck those guys. They don't really do anything anyway. I've heard ER nurses say that, right?
By the way, respiratory therapists are 100% needed in the hospital.
Yes.
For a fully safe and functioning environment.
Absolutely.
Especially in the ER and especially in the ICU.
We used to shit on them just for fun because it was funny.
Honestly, they were the best.
They were great.
Funny.
I loved all of our respirators. They could take a joke. You could shit on them a little bit. Like,
yeah.
And they were great. All the respiratory therapists.
Most of them. Except for the one that left me in the COVID room and wouldn't
That
come
guy
in.
was a dick.
I'm like, hey, he's dying. And he's like, I can't come in.
I can't come in. I'm like,
hello? His sats are like in the 20s.
He's like, no,
Can
only
someone
one
come
person at
code
a
this
time.
patient with me? Because nobody's coming in. That was the worst. I was a new grad doing that. Anyway.
He was a burnout though. He was counting the days until he retired.
Yeah.
He was not a good RT.
Yeah.
But he's the exception. He wasn't, he wasn't the rule. So, but they're just the RTs are very much needed in the hospital, just like security is very much needed in the hospital, and they're finding ways to cut out as much as they can. And if you're a doctor and you think your job is safe, hey, guess who's going to go first with AI? Yeah, you, radiologist. Radiologist, your shit's cooked, bro. You're a radiologist, you just spent 12 years becoming a radiologist, and you're like, yes, making $400K a year. You just got cooked. Now you better go put in your application for McDonald's or some shit, or start teaching, because AI is a higher rate of accurate readings than radiologists. So
it makes you think, do you think Mayo Clinic's decision about this is related to the fact that AI is coming into healthcare? And
I don't think so, because respiratory therapist is a very physical job. You have to have hands-on to do it. That's why the whole stupid idea of a tele-respiratory therapist, it's like teleneurology. Teleneurology is the stupidest thing ever. You have some guy at 2 o'clock in the morning, you're doing a stroke assessment, and he's like, you got the camera at the end of the bed, and he's like, put your arms up. Okay. And then, okay, nurse, touch. And I'm like, what the fuck are you? I could tell you what their NIH score is. Like,
what's the point?
What are we doing? Like, why are you here? Like, and then he'll put in stroke orders, So I just, the whole telemed thing, they're trying to limit resources to save money. That's what it comes down to.
But is it even saving money anymore, or is it taking money?
Well, yeah, I think, yes, save money, take money.
It's like, where the fuck is this money going? Lobbying against things that would protect the community for the financial benefit of private equity. But how do we get down to the bottom of who, like, these companies are, and especially the bigger corporations, and how do they get away with this shit?
Because nobody knows, and everybody's too busy worrying about gas prices, and they're like, well, I'm healthy now and everything's fine. It's only when you wind up in the hospital and the doctor intubated you, and they do a chest x-ray, and the tube's 3 centimeters too deep, and you're not getting equal perfusion on both lungs, so now the doctor has to back the tube out, or maybe it's the wrong size. Maybe you need a bigger ET tube, and so you got to change out the ET tube. That would be a respiratory therapist job.
It's going to be the nurse now.
You'd use a bougie and you'd switch out the tubes and everything's cool. Now, no, fuck no, it's not going to be a nurse. We're not trained to do that.
Oh, no, in the statement, I'm going to say, in the statement, they said the people that will be taking over will be videoing. The nurse will be videoing with the RT.
Oh, fuck that. I would never change out an ET tube or a trach or anything. That is new.
That's what the
fuck
rage
that.
is about.
I didn't know they were going to do that. I thought they were just going to have you, like, whenever the ventilator goes beep, burp, 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 beep, beep, they tell you which buttons to push. But
it says emergency and nursing staff will be taking.
I don't care what kind of emergency.
It's basically like, think about the hospital we worked at. We had RTNA, but other things we didn't, like lab or something, or we would respond to codes in the hospital.
Yeah, but
it's like that kind
never
of thing.
once did any hospital ever expect me to back out an ET tube or replace an ET tube or replace a trach or any of that shit.
And I saw that someone was saying that years ago, like 15 years ago, ACLS used to teach intubation to nurses.
That may
Or
be,
some-
but that
it
was
used to be
probably
within
emergency, like, you know, and then they got the
ACLS.
King Airways and stuff.
Well, yeah,
so,
but that's the point. Nurses don't get trained in this anymore.
no, we don't.
So
Because
what-
it's not within our scope. Like,
What does the Mayo Clinic think is going to happen?
well, clearly the tele-RT has the force, and he will be able to, or he or she, sorry, not to be sexist, them will be able to Baby Yoda that shit right out of him, and then Baby Yoda another one back into him. It's fucking dumb. Fuck all of you Dr. Evil C-suites assholes who came up with this. This is the stupidest shit ever.
I have a weird question. If you were sitting in a meeting with C-suite people, you wouldn't say that, but how would you talk to them about what a nurse actually sees day to day?
I would make them work 2 months, 3 12s a week, each assigned to a specific nurse, and they would have to be that nurse's bitch. And on med-surg, on ER, every floor, ICU, each C-suite person would have to rotate through all the floors for 2 months per nurse. And then they can make decisions on how the corporate structure is made and on what cuts they make. And only after they've been through 2 months rotation with each floor with a dedicated nurse can they make any financial decisions that affect patient care. Because they don't give a shit. Like, remember the fucking C-suite used to come through the ER with their little cart of treats at like 9 p.m. You guys want some Skittles? We really appreciate you. How about some security? Oh, we have security. Carla, the 56-year-old 5'1" woman, is here to protect you. Ugh. It's fucking bullshit. We have snacks for healthy people too. We have oranges and apples.
Covered in pesticides?
Yeah. Remember the one C-suite chick who is plastified and wore like 5-inch heels every day?
Oh my God.
She got fired for going up to the dementia ward and having people who are clearly incompetent sign documents so she could bill more.
Oh, she was signing them in to stay longer.
Ugh,
They weren't
fucking gross.
They weren't mentally there.
She wasn't-
If you're a medical person, they weren't alert and oriented. They were like A&O times 1,
Yeah.
and she was having them sign it themselves in for longer.
Yeah, and she wasn't put in jail. No.
just got
let go.
fired.
Yeah, just let go.
Or
It wasn't
maybe
even
she
fired. It
quit.
was just like she
They
resigned.
probably, yeah.
It's like, that's fucking fraud. What the fuck?
Yeah.
She was hot,
But
though.
then,
She spent
no.
hundreds of thousands of dollars to be hot.
Okay, so get this. We had a staff meeting, and she is one of the presenters. This is like, I'm still an ER tech at this point, but she's the chief financial officer, and she walks into the meeting for her presentation, and she goes, I'm so excited to share with you guys what I experienced this week. I had a beautiful stay at the Four Seasons, and I went with my dog, and the staff were so amazing. When I got out of the car, they greeted me with a water bottle. They knew my dog's name, my name. They were so warm and welcoming, and that's what I want to bring here. I want you guys to give people the Four Seasons experience. And I remember just sitting in my chair, just my jaw dropped. That was the first time I experienced a corporate level person in the hospital, and I thought it was a fucking joke.
I wanted to say, well, Ted, the bumsicle from 4th and Central Street, just shit into his hand and threw it on the wall.
The unhoused person.
The unhoused person. Fucking language control bullshit. No, he's homeless. He's a fucking loser. Bumsicle. Just shit in his hand and threw it on the wall. What do you think would happen if that guy walked into the Four Seasons, do you think he'd be like, oh, what are the name of your lice? What, oh my God. Is that like derelict style that you have? What is, how do you get the shit stain and the pee stain in your crotch? Is that like, super famous designer did that for you? No. They would call the cops and have you thrown out on your ass. She's a fucking retard, crook, evil human being. She's very Dr. Evil-y.
They all are.
And she just probably moved on to some other hospital or some other corporation to do evil shit. And she just keeps living her fabulous life. Nobody gives a shit. Mm-hmm. But whatever.
Yeah, it just seems to be a commonality across corporate, not just healthcare, but that's what we're talking about. But
yeah,
just
and we've
corporate.
We've worked in a ton of different hospitals being travelers. It's all the same everywhere. So if you're like, no, that's just your hospital. No, it's a lot of them. It's a lot of them. So Mayo Clinic, shame on you. I hope you.
Yeah.
Apparently this is going to go into effect in August. So get your shit together.
Yeah. We're all watching now.
Yeah,
we all know what's going on.
Stop this. This is stupid.
Yeah, your healthcare workers do not want this. You're going to probably lose a lot of nurses.
Every C-suite person at Mayo Clinic should do a month to 2 months with each nurse on every floor before they can make a decision again. This is the worst.
Yeah.
Fuck you, Mayo Clinic.